everybody. I'm excited for us all to be here with some people that I really respect and always appreciate conversing with. We're talking about spirituality and psychotherapy and how they influence each other, how they may come together, our thoughts on that. And the plan is, if you're watching this on video, you'll see that the plan is we're each gonna solo for 10 minutes or less about our initial thoughts, and then we'll come together and have a robust discussion from there. And then this will be posted on social media and things like that. And I believe Dr. Sophie Archibald is gonna start us off.
That's right. So I'm really excited to talk about this. It's both very intimate topic, I feel. At least it is for me. It's a very personal topic, as much as it is involved in psychotherapy. So to begin, I guess, sharing my thoughts around spirituality in psychotherapy, I would start by saying that spirituality is equally important as cognition in psychotherapy and as important as the role of the body. And I have a few excerpts, a few quotes from different books that capture for me these two topics of spirituality and psychotherapy. So the first excerpt, that little quote I want to share, is from Dogen's work, and hopefully you guys can see this. And so it's on page 66. It's pretty short. And the quote is about what Dogen calls the total experience. The total experience of a single thing does not deprive a thing of its own unique particularity. It places a thing neither against others nor against none. To place a thing against none is another form of dualistic abstraction. When total experience is realized unabstractedly, the total experience of a single thing is the same as the total experience of all things. A single total experience is a single thing in its totality. The total experience of a single thing is one with that of all things. So Dogen's thoughts here on this total experience, to me, speaks of I guess taking it out of the context of the book, but into the topic of spirituality in psychotherapy. To me, the psychotherapy without spirituality would be to have an experience that is not a total experience, where there's something missing within that experience. There's also something to do with this quote that I'm going to link back around after the last quote, but because I want to make another connection of why Dogen's quote is meaningful in terms of the relationship of spirituality in psychotherapy. To me, when I think about spirituality also in the therapeutic process, I think about other topics like love. So spirituality to me also resonates with that love in terms of the agape sense of love, this unconditional, divine, mystical love. And now I want to share a little bit of a quote actually from Dr. Shurura and Paul, who wrote this book on love and therapy and relationship. On page 23, they quote that existential love is a love that is true of itself and clear about its own purpose. It is a love that knows it has to be lived in action rather than merely a passive emotional experience. It is an active work towards the enhancement of that which is loved, and as such, is full engagement and commitment to the other's whole being, physically, mentally, emotionally, and spiritually. Existential love is opted into again and again, is always in question, rediscovered, and re-engaged with. Love is never a given, but always a miracle of connectedness. In this, it is like life itself, constantly in danger and yet ever reaffirmed in a myriad of ways. To me, this is one of the ways that spirituality is manifested in psychotherapy through the very essence of this existential love. Also, when I think about spirituality, I think about another word like mystery. It feels sacred, and it feels at times better explained when it's not as spoken, but acted upon, just like this quote said. And Carl Rogers, I really liked in his book, A Way of Being, was talking quite a bit more on this mystery. And in here, like in page 83, so this one might be a little bit longer of a quote, but I find it meaningful. I hope that it's a quote that you find just as meaningful too. He says, during these years, I've been, I think, open to new ideas. The one of most importance to me have to do with inner space, the realm of psychological powers, of the psychic capacities of the human person. In my estimation, he says, this area constitutes the new frontier of knowledge, the cutting edge of discovery. He says, 10 years ago, I would not have made such statement, but reading experiences, conversations with some who are working in these fields have changed my view. Human beings have potentiality available, a tremendous range of intuitive powers. We are indeed wiser than our intellects. There is much wisdom, much evidence. We are learning how sadly we have neglected the capacity of non-rational, creative, metaphoric mind. The right half of our brain, biofeedback has shown us that if we let ourselves function in a less conscious, more relaxed way, we can learn at some level to control temperature, heart rate, and all kinds of organic functions. To me, spirituality is very much one of the, and that's my opinion. That's not what he's saying. To me, as a psychotherapist, spirituality, the mysteries within myself and the clients that are available in the therapeutic process are very much organic functions and available for us. He says we find that terminal cancer patients, when given an intensive program of meditation and fantasy training focused on overcoming the malignancy, experience a surprising number of remissions. He finishes by saying, I'm open to even more mysterious phenomena: precognition, thought transference, clairvoyance, and human auras. And he talks about this phenomenon may not fit with the known scientific laws, but perhaps we are on the edge of discovering new types of lawful order. I feel I am learning a great deal in a new era, and I find the experience enjoyable and exciting. And so to me, the psychotherapy, the way spirituality, I feel like it's a good place to start this conversation, and all of these celebrate and honor all of the different ways that spirituality has met to me in my clinical practice. And I feel and I believe, just like how Rogers was saying, that it is very much the cutting edge of discovery. And I think even more that I would say it's the forgotten intelligence. We're really concerned about artificial intelligence. But I'm more interested in this forgotten intelligence that is the spirituality. I think that sums up my first initial thoughts on that.
Thank you so much, Sophie. Roberto, I think you were gonna jump in next.
Yes, that's a lot of food for thought there, Dr. Archibald. That's great. I got kind of lost in the thought of being able to really be in that creative space is what I was hearing you say, and to be able to find spirituality. So the word I picked up is open to new ideas and the psychological powers that we don't know that we have. And if we can be open to new ideas, then we're able to develop it. And also, for me, spirituality goes back to like the childhood state, right? Child state, because we learn this stuff when we're young. We're really apt to believe it, and we start to experience things. And I think that this is why some children are able to gain such big goals, because they don't know that they can't until they start to try things out, and they still don't give up because they're like, I don't know that I can't. And that's, to me, very spiritual. So for me, the spirituality, was learned at a very young age. And when we start to lose it, or at least where I started to lose it, was where I started to not feel safe and be able to trust. And a lot of the stuff that I learned, like in church for confession, for example, right? I learned penance. So in penance comes pride, and then we start to lose the spiritual aspects of it. And so from my standpoint, working with people of my culture and people of heavy trauma, there's a fear there of being punished for having experienced different things, without realizing that we can make it better by exploring spirituality. And nobody has to tell us what that looks like. We can work on it and develop it. So the safety issue stands out for me in trying to be open to the psychological powers. So there's a big safety issue there, especially if people haven't experienced safety growing up, right? So one of the things that I did look up was John 14:26, and it says, "It is through these 7 gifts, wisdom, understanding, counsel being the third gift from the Holy Spirit," right? And so to be able to get counseling is great, because we learn truths, right? The reality is, if you keep doing this is what's going to happen, based on the theories that we have, or based on what we've learned as past experiences. And so on learning those truths, then we can actually gain more knowledge into what's happening underneath of that. And so the creative side of us often gets lost as we become adults, as we experience things like pride and shame and guilt that we learn growing up, or from our families, or from our experiences. And so I think in psychotherapy for me as a therapist, developing that safe space for patients becomes really important so that they feel comfortable saying things that we often look for. For example, they'll say, I've never told anybody this, but, right? And this might sound crazy, but I think I've had a premonition. And so we kind of, I kind of look for those things, and I tell them that doesn't sound crazy. That makes a lot of sense, right? I had one patient that said, I knew from the very beginning that alcohol was going to be a problem. I don't know how. And I said, that's because there's something in you that says this is not what you want to be doing, right? What is that called, right? And let's look deep inside to be able to explore what that looks like. So for a lot of people, the whole God aspect becomes very confusing for them because it brings up rules and regulations without the love aspect that Dr. Archibald was describing there. And that love aspect is brought up again in a safe relationship so that you can feel a little bit of safety and maybe experience the love for yourself, which is the most important. And so I got a lot out of what Dr. Archibald was saying, and also related to the reason that I became a psychotherapist is to help other people gain their truths, and through counseling and to going back and forth with each other to be able to figure out what is it that I really want to do and how can I experience that. And so now I think we're in a new frontier because I've studied the somatic experiencing, and we didn't do that back then. You know, we used the old methods of REBT, CBT, DBT, and that was a lot of telling people, well, here's what you do to get that, and without being able to actually feel good, right? So the behavioral therapies can give us a different result, but doesn't necessarily make us feel really good about ourselves until we can experience some of that love in the relationship, some of the ruptures and forgiveness, and then the expansion of love, and then be able to stay with it and figure out what is that, could that be God inside of us? So that's the ideas that I was having, because I really am excited about this topic and a meeting with you guys to be able to explore more ways of how that came about for us individually, and also on ideas of what we can do to help others say, you know what, this psychology thing, it's really okay, it's safe, and I'm going to be with you. So we're going to explore it to figure out what else is there for you, because in the resting part, right, in the space where nothing happens, that's where the change takes place, right? And so we have to learn again, I think, how to be childish, how to rest, how to be creative, and how to explore what that spirituality is, feels like, and what to do with that. And that's my thought. Thank you.
Thank you, Roberto. This is all so good. Charlotte, I believe you're gonna go next.
Thank you. I'm feeling all of what's already been presented in me right now. And I want to say 5 different things that this work called Mindful Awareness and Body-Oriented Therapies. I went to a presentation about spirituality, the themes that came out when people experience 8 sessions. And I asked the presenter, how did you find these 5 themes? And she did this thing like this. And I feel us doing that, like, well, here's just some things I felt as I was with everyone. I think there were, I'm not sure, 16 people, 8 sessions each. So here's the themes: experiencing wholeness, experiencing your true nature, experiencing that your body is nurturing you, awakening inner knowing, and the experience of that this is healing. There's been lots of life experiencing, but now I'm experiencing healing. So I want to start out with some of those themes as I speak. The other thing I want to start out with is a visual here. Spirituality and therapy. And my question is, What is the something that ties these two together? What is alive in psychotherapy when spirituality comes in? And I am a focusing professional, so the topic I want to talk about, the something, is the felt sense. And in order for the felt sense to be alive and keep growing, is this kind, friendly presence with it, this environment that psychotherapy allows for. And kind, friendly presence with the felt sense can happen many different ways. So I want to talk about what a felt sense is, and with the example of being a child. Here's an example. So if a child is asked, do you want apple juice or orange juice? They might go, apple juice, and they're feeling the apple juice in their body, or they're feeling the memories in their body about apple juice. And then they might go, orange juice. Oh, and then they might go, they're feeling the memories, they're feeling what their body really needs in the moment. And an adult might be like, just make the decision. And they're in the moment, they're taking their time. And so that's, in order to feel all the different variations of what's happening in a decision, that is the felt sense. And another way to talk about felt sense is, if you think about a friend that you know, and they knock on that door, think about one friend that you know knocking on your door. Even before they come in, you have a felt sense, a knowing about that friend. And then now think about another person that knocks on the door, and it's another friend. And there's a whole different constellation of feelings with this other friend. And that's what a felt sense is this whole big constellation. I'm going to put up another visual here that talks about all this variation of constellations about what a felt sense is. And so how does spirituality and psychotherapy enter into this big constellation of this alive living process that's here in the room? It's always here in the room. We just do we make enough space for it? So the constellation of what makes a felt sense can be any of these: emotions, textures, gestures, physical sensations, locations in the body, outside of the body. Spirituality is way outside of the body sometimes, and can be way inside of the body. It really is personal how you experience spirituality. It can be experienced in the text that we've been just reading today. We all have texts that really speak to us about what spirituality is. How do those words and stories resonate in us? That is what we can talk about this for a long time. So I just want you to get a taste that felt sense is a whole constellation of experiences. And then I'm going to take this down and talk more about this kind, friendly presence. This kind, friendly presence is happening, like I said, in all psychotherapy rooms. But here I'm just making it kind of explicit that there's this kindness and warm presence and being with happening. And again, like you said earlier, there's a safe place happening in the psychotherapy room. And for a felt sense about spirituality to continue to flow, these are the steps that are needed. And this is from Jill Drummond, who was a focusing professional who researched all the different focusing professionals, how they taught. And she said, here's the common things that people are teaching. So in this warm presence, this being with, there's a pausing with this constellation of experience called the felt sense, and describing it and checking with it and receiving the knowledge and the wisdom from that felt sense. Again, think about or feel the spirituality text that you've brought with you. And there's a process of finding that text. What is the text you want to bring? So you pause with that process and you checked in with your felt sense and said, this is the right one. This is the text I want to bring today. And okay, so I'm wanting to now take that all in and ask some questions to you about spirituality and focusing and psychotherapy. So when you're in the psychotherapy room, there's a question I want to come to here. Let me get to my notes. When you're there, it might take some time for the client's spirituality to come out. There might be little twinkles of it. And it might take some time for you as the therapist to come into contact with your own spirituality with the client's spirituality. So what is what's the question I want to ask now? I'm going to pause. What are all let's just think about this together and feel this together and experience this together. What are the questions that come up in a psychotherapy room when there's two of us together with different spiritualities? And when there's different meaningful questions coming up about life and death and illness and grief and war and climate change, and what is it that is the living process that's wanting to come forward? What's alive, and how do you nurture that? How do you just pause and be with something new that's come up in the room? And what of this might kind of spark new now that you've just heard the different steps that are common? This is a living process that all of us experience, children to the dying process. We're all wanting for life to move forward in this kind of way. The last bit that I want to give you is a poem by Naomi Shihab Nye. She's written a poem called Kindness. Before you know what kindness really is, you must lose things. What you held in your hand, what you counted and carefully saved, all this must go. So you know how desolate the landscape can be between regions of kindness. You know kindness as the deepest thing inside. When you know that, then it is only kindness that makes sense anymore. Only kindness that raises its head from the crowd of the world to say, it is I you have been looking for, and then goes with you everywhere, like a shadow or a friend. And what I feel is that the focusing process is that kind environment and kind steps to be with the new, fresh, living process that's alive in spirituality and alive in the psychotherapy room between two people. Thank you.
Thank you, Charlotte. Yeah, wonderful stuff. Dr. Deussing, I believe you were going to jump in.
Yes, I will drop in. There's a lot here. I've already learned so much as I do from these discussions. You know me, Chris, I kind of drop in a little bit like a bull in a china shop and just see how this all comes together. However, I just wanted to, I spent all day thinking about this. This is a very slippery topic. It can be a very divisive one too. One, because I think that people can immediately associate spirituality with religion. And I hope that more inclusive conversations can be had that include spirituality, that include religion, that include each individual's experience of spirituality. However, before all that, the word definition from Oxford, spirituality is the quality of being concerned with the human spirit or soul, as opposed to material or physical things. Kind of like that definition. But I found another one that I think fits psychotherapy a little bit better from the Royal College of Psychiatrists. This one states, spirituality involves the recognition of a feeling or sense or belief that there is something greater than myself, something more to being human than sensory experience, and that the greater whole of which we are part is cosmic or divine in nature. So the reason I really like this is in my dissertation, I studied DBT at a very advanced level. And a lot of people think that dialectical behavior therapy is all about behavioral change. However, when we get to the later stages of advanced DBT, one of the things that really emerges is the ability to mentalize and metacognition, which here just kind of goes hand in hand with the Royal College of Psychiatrists and what they're saying about spirituality and what that is. The ability to realize that we are interconnected to people around us, to the ecosystems that we move through, to the environment, to the climate, to the earth. We can zoom out and in as microscopic or as macroscopic as we need. And I think that when we move from the psyche, so the definition of the psyche is the human soul, mind, or spirit. Then when we go to psychology, we have the scientific study of the human mind and its functions, especially those affecting behavior. So I almost feel like with the scientific level, we strip away part of like what can't be measured, the human soul or spirit. Then we add clinical psychology to it and even become, I think, further removed from the essence of what spirituality is in terms of that there is something greater than ourselves outside of our ego. Everything is interconnected, intersubjectivity theory in terms of we're both influencing each other. We are not separated. We are not isolated minds. I feel like in this increasingly materialistic society, we can lose sight of that. And not even just lose sight of it, especially in an American westernized culture that really prides itself on individual and the standing alone and being able to take care of oneself and pull yourself up by the bootstraps. We really lose the community that is spirituality too. That's another thing that came to mind when I was thinking of spirituality in terms of community and connection. A couple of personal experiences I just wanted to share that kind of make me think about spirituality. I remember when I was a young social worker and I was newly licensed, and I was working in a mental health unit that was embedded in a primary care facility. And the one day I walked through the hallway and they changed the sign above the unit, and it didn't say mental health care anymore. It said behavioral health care unit. And I almost felt like a part of me died that day. And I couldn't really grasp what that was at that point, but now I understand what it was. And then another memory that came to me that I really had kind of forgotten about, my father, who was a born-again Christian. He found Christianity later in his life after almost dying from cancer. He came to me when I was newly in private practice. And so again, I was a young social worker, really excited to be in private practice, a little bit immature in terms of like, I am in private practice and I'm going to make money. I'm going to be successful. I'm going to reach the apex of practice. And my father just looked at me and he said, Christopher, you're running a ministry here. You're ministering to people, and that has always stuck with me because when I get too high on my therapeutic pedestal as the almighty therapist or the almighty doctor, I always can come back to that and just remember that this is a ministry. I am ministering to people, and I think that that's a much more human way of putting it. In terms of therapy, I see a lack of spirituality in many ways. I did an informal poll today on LinkedIn, and about a fifth of clinicians said they don't incorporate spirituality at all in their practice, and I honor and respect that. That is for each their own. However, for myself, I don't know how I could do this work without a sense of spirituality, because if there's no spirituality in it for me, I merely become a provider of modalities. I am no longer a therapist or a healer. I am just a DBT provider or a CBT provider, or just fill in the blank of whatever the latest insurance company wants or whatever we can get done between 8 to 12 sessions. Some of the things that I've said here that have really resonated with me in terms of Sophie bringing up love makes me think of Sigmund Freud saying that psychoanalysis is in essence a cure through love. I think that we get scared of that word because of the conceptualization of erotic love and how that's going to lead to ethical violations. And this agape love, these other types of love that are very profound, I think are just really at the essence of healing, at least in the therapy that I provide. Also, too, a lot of young clinicians coming out that I train, they are all about fixing things, like doing therapy. I really think that the spirituality component stresses the being of therapy, the embodiment of therapy, not being so quick to fix it behaviorally, but just being and bearing witness, and also to presence and experiencing that shared sacred space with the client, which it truly, for me, is a sacred space. And so with that, I just want to close out with a couple things. The passage I chose was from the Tao Te Ching. It's passage number 15. And I think this really speaks to the being versus doing. It states, the sages of old were profound and knew the ways of subtlety and discernment. They were careful as someone crossing a frozen stream in winter, alert as if surrounded on all sides by the enemy, courteous as a guest, fluid as melting ice, whole as an uncarved block of wood, receptive as a valley, turbid as muddied water. Who can be still until their mud settles and the water is cleared by itself? Can you, as a therapist, remain tranquil until the right action occurs by itself? So that to me really embodies the being of therapy. And then too, something was mentioned about pause and taking time, and spirituality isn't something that we can force or catalyze or accelerate. So really, a lot of times I'm working with clients, and not that they have to believe in a God or a higher power. However, I see a lot of therapies as being congruent with the serenity prayer in terms of grant me the serenity to accept, maybe to radically accept the things I cannot change, the courage to change the things I can, and the wisdom, the wise mind to know the difference. I don't think that we need to necessarily have a higher power or a God. That can really apply to a lot of therapies. Makes me think, again, I know I say this a lot, of Rollo May and him stressing the power of the pause. And I think in that pause, a lot of the power that this discussion has really illuminated to me is spirituality. So those are some of my thoughts. I'm so thankful to be here in this space with all of you. And thank you so much for already teaching me so much. And I'll hand it over to you, Chris.
Thank you, Chris. This is exciting. I can tell I'm gonna be watching our video of this a few times or listening to it like when I'm on long drives and stuff. So I'm gonna jump around a little bit. Let me start with this idea of therapeutic presence, right? Being present with the client. For me, as part of my spiritual work practice, presence is something that is actually opened to. So it's to me, presence is something that's there. It's in the universe. So it's just something when I'm being present with the client, the techniques that I have or the practices that I have to attempt to be able to be more present, whether it's meditation or certain spiritual work or reading certain things or like mantras or reminding myself of certain things, that's all in order to be able to open up to something that's already there. And that then the question then becomes, what is it that's already there and why is it, or where does it come from? And that's part of kind of where my spiritual work and beliefs is. I'll back up for a moment and I kind of, I thought of kind of a caveat, which I think knowing everyone here, I think probably everyone would resonate with, is that of course I'm there to serve the client. I don't push my beliefs on them. We don't push our beliefs on them. And I think my spiritual practices, I think at best are helpful. And I think at worst, it's just going to be irrelevant. Like I don't, for example, what I just said about presence, I don't necessarily ever bring that up to the client. I mean, a lot of my clients have spiritual beliefs and practices. A lot of them don't. I've worked with clients that are Christian, Buddhist. I've worked with clients who practice a lot of yoga, influenced by that. I've worked with clients that are pagan or Wiccan or different native cultures and spiritual systems. So, that's one thing about presence. I also think like those common factors in psychotherapy, like the therapeutic relationship and repairing ruptures. I think there's also an element of those profound common factors that they've shown help no matter what type of therapy you practice. If you practice DBT, the therapeutic relationship is important. If you practice psychoanalysis, the therapeutic relationship is important. If you practice existential therapy, it's important. I happen to believe that the therapeutic relationship is also something that you kind of open to. And because of some things about the way we are as humans, to be able to open to that isn't always so easy. That might take a lot of reading and training and practicing to be able to open to something that's there. So going back to my question of what is presence and why is it, here's where we get to, for me also, spiritual ideas and in existential therapy, we might talk more about the ontological or being. So sometimes it's said, like Rollo May said, existential theory takes psychological ideas and makes them ontological. So takes them out into the realm of the universe or into existence as a whole. So why is presence important? There's, of course, we could talk about nervous system. It helps regulate the client's nervous system, and then they can open up to more difficult material and work through it. You're healing attachment wounds. And the existentialists might say, yes, and also, what does that say? The fact that presence is important in therapy, what does that say about our existence as humans? And what does that say about life on Earth? That presence is important. And I feel like once we get up to that realm, it's kind of a spiritual realm. It's so for me, and I'm not saying, when I say these things, I'm not saying that I always practice it or can always do it by any means, you know, so, but I'm working on it, is that presence is so important because it's part of why we're here as humans. According to my kind of spiritual beliefs, that I'm here as a human to be present with other humans and to attempt to be of service to other humans and the earth. Right. So I'm not only doing presence because it regulates someone's nervous system so that their trauma symptoms can come down. I'm doing it because that's why I'm here as a human being. So I feel like that gives me an extra level of motivation and adds a richness to it. And so I'll say that I think this idea of someone going to therapy, I mean, I think where also spirituality comes in to me, for me, is that according to my beliefs as humans, we kind of need to work on ourselves. Like it's not so easy. There's the idea that we're born with a soul, and there's the idea that we actually have to earn a soul. Like we have to develop a soul, you know, and these are different ideas. So when people come to therapy, of course, I'm going to meet the client where they're at. So if they have absolutely no spiritual interests and they want to get their symptoms down of their anxiety and move on, then that's what I'm going to do. I'm more interested in a certain sense if someone wants to get some symptoms down and then lead the most meaningful life they can. And I think and work on themselves for bigger reasons, right? Which I think also people come to therapy for. And I know there's like a famous book that came out recently, or it's getting a lot of press about ways therapy can go wrong and ways therapy might be encouraging, especially younger people to like navel gaze or to think everything they've been through is a trauma or whatever, and not challenging people enough. And I get that too. I think therapy should be, for me, should be about safety, but also challenge and growth. But I also think it's legitimate to come to therapy even if you don't have major debilitating symptoms, because you want to work on yourself and grow and evolve spiritually or morally, or become more present, become more creative, be more of service, be able to handle more types of human interactions at a higher level. I think one thing I wanted to talk about was this idea, a couple of ideas, the idea of essence and personality, and the idea of the inner world and the outer world. So one thing I think about that comes up in my spiritual work is this idea that, and I feel like Roberto touched upon this when he talked about we come in as children and there's a certain amount of wonder and openness and willingness, and we try things, and then maybe for better and worse, the cultures, different types of cultures get a hold of us, and some shame, some guilt sets in, some ideas of the way you should be, and this and that. According to my belief system, that would be kind of personality. So a human has their soul, their inner world, and their ability to develop a soul, their spirit, and their personality, their enculturated aspect of them. That's good and bad. And part of the therapy process is kind of sorting through that and working through in what ways have you been kind of jerked out of your wonder, your creativity, your presence, your willingness, your openness. And maybe some of that was necessary to survive in the world. We do have to function in the world and have an ego and have these things to get by. but maybe we can strengthen up that essence again, the ability to be with yourself. And something Chris said struck me is that being with the contrasts and being with some of the quote unquote negative experiences that might not, that if we work with them the right way, might not be totally negative. And I think that's kind of can get into the spiritual realm of if anxiety, for example, or guilt is only bad, then that's kind of I think more, it can get kind of shallow, like kind of the overly medicalized model of you have too much anxiety, we'll bring it down with a medication, which might be necessary for some folks. And yet, if we bring it into the ontological, why do we have anxiety and guilt on like almost a cosmic level, on a spiritual level? In these days, we're more comfortable talking about the positive aspects of anxiety from a nervous system level. Like we're willing to go there in terms of, yeah, all the nervous system stuff. But what about when you blow it up into the overall, the universe, you know? And I have, you know, ideas about that, but I think it can be helpful. Jumping around a lot, there was one other thing I wanted to say. I kind of went a similar route as Chris with, you know, I went to like the root words. And so, right, the original use of the word psyche meant both soul and mind, because the folks that came up with the word didn't really distinguish between like soul and mind necessarily, in my understanding. So the original, if you want to go with etymology or root words, psychotherapist means someone that ministers to or treats or heals the soul, right? Which maybe there's mind right close on its heels, but the commonly accepted thing is that we're treating the mind and the emotions and the body, and we leave that part out. And the word spirit, the root words, it comes from breath, breathing, with connotation of courage or vigor. So spirit is sometimes seen as a vital principle or an animating essence, a basic natural force or principle. So I could be said for me, according to my kind of practices, is that as a psychotherapist, I'm trying to tend to treat and heal so that the person's spirit can animate them, and can be not so covered over or blocked out. And what I'd like to do is read a passage from the Tao Te Ching, which I know Chris also did. So I'm going to read a little bit and then talk briefly about it, and that'll be my little solo here. So the Tao that can be told, so the Tao meaning the book of the way of life, the book of the way of life. The Tao that can be told is not the eternal Tao. The name that can be named is not the eternal name. The unnameable is the eternally real. Naming is the origin of all particular things. Free from desire, you realize the mystery. Caught in desire, you see only the manifestations. Yet mystery and manifestations arise from the same source. The source is called darkness. Darkness within darkness, the gateway to all understanding. When people see some things as beautiful, other things become ugly. When people see some things as good, other things become bad. Being and non-being create each other. Difficult and easy support each other. Long and short define each other. High and low depend on each other. Before and after follow each other. Therefore, the master acts without doing anything, and teaches without saying anything. Things arise and she lets them come. Things disappear and she lets them go. She has but doesn't possess, acts but doesn't expect. When her work is done, she forgets it. That is why it lasts forever. So something I was thinking about this is that first line, the Tao that can be told is not the eternal Tao. So from my sense, spirituality and psychotherapy, I have this sense sometimes that pre-verbal, and then I think a lot of us have touched on this, felt sense, what's not said in therapy, those spaces where we're looking within, those are often the most profound, right? And sometimes when clients get wrapped up in the self-judgment, or the need to, or the therapist is wrapped up in self-judgment. So if I'm in there as a therapist and I'm constantly judging myself if I'm doing good enough, or I'm constantly feeling pressured to fix the person, that's one way of being. And sometimes it comes in handy if there's a crisis or they need or want that. But for me, when I'm more grounded in my spiritual practice, I'm more open to those spaces and to the mystery. And oftentimes that's when the client seems to feel my presence and will dig a little deeper and we'll find something, or we'll feel something and maybe they can't quite put words to it. So yeah, I'll stop there for now. Those are my initial thoughts. And I believe we were going to kind of have a free-flowing conversation. And I realize I didn't introduce everybody with everybody's credentials or anything, but when I post the video, I'll put little info about who we all are so people know that we're serious people. Who wants to jump in? Any questions? I certainly have questions for each of you, but.
I just
Serious
want to jump.
questions, right? Right, Chris?
Yeah,
Go
right.
ahead,
Only
Charlotte.
serious. We're serious. I have
Yes,
lots of
very
letters.
serious.
Yeah.
Charlotte.
I just want to jump in with this part. At the end of what you just said, our definition at Focusing Initiatives International of presence is no goals, no bias, and no judgment. That's how you know whether you're experiencing presence or not. If you're experiencing one of these, then you're experiencing something that might need some presence.
Interesting. Yeah.
And this part, there's always pushback about the no goals part, because it's not about not having goals in life. It's that in the moment, in the present moment,
Yeah.
that life process isn't feeling a goal on top of it.
Yeah. And what comes up for me is the paradox in therapy sometimes of if I'm pushing the client too much toward their goal, they might resist. And then when I'm like, okay, I'm here, and then they may pick up the mantle and figure out what they really want or something anyway. So yeah, I'm right. And that's a very kind of Tao Te Ching type thing, is that when you're not frantically trying to do something, then sometimes things get done, There's that kind of thing, yeah. Well, something that struck me right away was, Sophie, when you were saying how love is never a given, and yet it can be reaffirmed each moment, I think. And I think I know this idea of different types of love, I think, is important, because I know, like Maslow said, for example, that you can't really, a lot of people have said, you can't really understand someone unless you love them. This
Mhm.
idea. So like Maslow was criticizing some research and stuff because he was saying you can't really understand your research participants if you don't love them. And so that's an interesting thing. And but as therapists, you know, we're not supposed to run around saying, I probably wouldn't say to a client that I love them, depending, I haven't, at least I haven't yet. But I certainly feel, because it might be misinterpreted in so many ways, but I certainly feel a platonic love and affection for my clients, you know.
Yeah, in fact, in the book that I got the quote from, Dr. Sharura and Paul were listing some of the 6 forms of love. And they talk about the first one being a parental love for their offspring. Another one is the love we feel in companionship in a community. Talking about a brotherly love in that case. The third is eros, which is what we talk about in terms of sensual and sexuality or erotic love. Then we have the love of strangers and our neighbors, in hospitality. That's, I'm not sure I can pronounce that correctly, xenia. And then there's narcissism, so self-love. And the 6th is agape, that unconditional divine mystical love. So I found that very helpful to have these different being explained. And in a sense, I think about spirituality in terms of just the manifestation of that agape, and in a sense, those feel interconnected. How I have worked through my own self-love, or I understand the meaning of maybe who I am. Now we're going back to who am I, and spirituality, and my sense of purpose, maybe, and meaning. And it can be explicitly talked about in psychotherapy, and sometimes it's just very implicitly there. And I love the kindness poem. It's my favorite poem, so it was really special. That Charlotte, you read that. It was really special. And the interconnected mind that Dr. Deussing you were mentioning linked back around to me what Dugan was saying, that in that totality of experience, through that presence that you talk about, Chris, with that, when total experience of is realized unabstractedly, there's everything in that moment. There's everything in the present moment. And the single total experience of a moment, there's the entire being of the client, there's the entire being of myself, and there's the totality of all things within that. And it very much feels like this moment that even I have found Carl Rogers described so well, when there's that totality of presence where everything is there, of the client, of myself. He just described that so well. He says, when I'm at my best, I discover, let's see, I find that when I'm closest to my inner intuitive self, when I am somewhat in touch with the unknown in me, when perhaps I'm in a slightly altered state of consciousness, and then whatever I do seem to be full of healing, then simply my presence is releasing the helpful to the other. There is nothing I can do to force this experience, but when I can relax, be close to the transcendental core of me, then I behave in strange and impulsive ways in the relationship, ways which I cannot justify rationally, which have nothing to do with my thought processes. But these strange behaviors turn out to be right in some odd ways. It seems that my inner spirit has reached out and touched the inner spirit of the other. Our relationship transcends itself and becomes a part of something larger. Profound growth and healing and energy are present. It encompasses very much to me what spirituality in an implicit way is present in the psychotherapy process.
Yeah.
This makes me think too, I think we're talking about, in the frame of one-on-one therapy, some of the most profound experiences of spirituality that I've had in practicing psychotherapy have been in group therapy. So it really makes me think, Dr. Archibald, about almost the blending of relational dynamics of all that richness, right? All the richness that's present in a one-on-one interaction. As I'm listening, to Chris talk, right? I'm interacting with him. However, in a group format, I've been in groups where the process is almost felt like it's elevated to another level and almost become, for lack of a better term, magical, and just almost taking my breath away. So how you broke that down, Dr. Archibald, is beautiful. Made me just think of the group process. And that brings up kind of the community aspect of what I was trying to communicate, of how that contributes to spirituality, which, Chris, if we think about some of our men's mental health panels and the epidemic of loneliness, then we can start to think about, wow, this loneliness, how is that feeding into perhaps a loss of spirituality, both on a micro and macro and meso scales?
Yeah. Yeah. I have a lot of thoughts on all this, but I want to hear from everyone. How are you thinking about this, Roberto and Charlotte? Yeah.
I really enjoyed the readings because there's so much more out there than what one person can actually capture, right? And we all brought a lot to the table. And I've been thinking a lot about all the readings that we've been pulling up. And last night when I was reflecting on this and about how we're gonna, come up with our own ideas and our own versions, I actually came up with something of why I like psychology. So I'm going to read it, all right? I'm going to be very vulnerable here. I wrote, I love psychology because it grants me full access to explore my personal meaning, encapsulated by every external influence to no end. I am able to join with my clients in the discovery of their innermost potential and help them gaze out the window of Johari toward the very peak of Maslow's pyramid and choose how spirituality serves our needs. I thought that would be, the idea of doing one-on-one therapy. And then when Dr. Deussing was talking about the whole magical concept, right, of being in group, it gets elevated and we end up in the zone, right, of what the work is. And we have to, as therapists, realize we're also getting carried away on that. And let's be right here, right? Let's just be present. So thank you guys for letting me share that and be here with you tonight.
That's beautiful, Roberto.
Thank you.
That was really exquisite. Thank you.
Thank
Yeah.
you.
Hmm. Something that's coming up for me is the mystery, the unknowing aspect, because, and I feel like it came up in the Rogers quote that Sophie that you read, and you know, we're talking about the felt sense and not only having to know things with the cognition. And I guess let me kind of explore a concrete example. So I was reading some Rollo May, and he was talking about without guilt you can't have hope, right? So he was bringing that up. So existential psychologists bring up these paradoxes and dialects sometimes, like without anxiety there's no freedom, without loneliness there's no love, without boredom there's no meaning, without guilt there's no hope, and kind of this the yin and yang of things. And of course, but they also acknowledge that this is kind of existentially, ontologically speaking, there is such a thing as what maybe used to be called neurotic guilt, or obviously we can go through traumas and end up completely ridden with shame and guilt that isn't ours, or maybe some of it is ours, but it's extreme and it's debilitating, right? So I'm not saying like guilt should just be fine and whatever, but when we bring it to the realm of the ontological, like guilt as a human being, the knee-jerk or the automatic mainstream thing is, well, guilt is good from an evolutionary perspective because it's pro-social. Like if you do something that makes you feel guilty, then it stops you and you need to go apologize, and then you're accepted by the tribe and you're not in danger, right? You're not going to be cast out to die, right? So that makes perfect sense. But then again, like some of the magic gets lost and some of the inspiration and beauty and mystery gets lost with that for me. Whereas when I'm thinking a little bit more quote unquote spiritually about it, it's like there's a mystery to guilt. I mean, guilt is a word that has a lot of baggage, and we've been culturally, maybe some of us had too much guilt, you know, smacked around with too much guilt and everything. But guilt is an experience. The word is not the thing. So I experience this thing that we call guilt. It stops me or it weighs on me. And yet the existentialists say without guilt, you can't have hope. So what they mean by that is on some level, we have guilt because we know that each moment we have a certain amount of freedom, however limited, a certain amount of choice, and a certain motivation to control our destiny or to be aligned with our destiny. And when we don't do that, we feel something. That's kind of set up in the universe. That yes, we have culturally programmed guilt where I feel guilty because I had a sexual desire, or I feel guilty because I don't have the perfect body or whatever. We have all that's culturally programmed guilt, right? But then you take that away, there's still something profound about I want to actualize my destiny as a human. We each have a destiny, at least I believe we have an essence, we have our uniqueness, and it can get really clouded over and enculturated out, and that can create a sense of existential guilt. We want to become what we're here to become, and we don't know necessarily always how to go about it. But yeah, that's just something that comes up for me, is like this unknowing. Like I try to stay open to, I have certain beliefs and practices, but I don't know for sure that I know what I know. I don't know for sure that I don't need to. And when someone has guilt, I don't want to assume that I know right away that it needs to be eradicated, or right away that I know the right thing to deal with it, or that I know for sure that it's just an evolutionary thing, or it's just a trauma thing. Right. I don't know. It's bigger than that. It's a human thing. Right. And so I feel like that's one way that the spirituality comes in, that I wanted to run by you all and see what you think, or if you have other thoughts about that type of stuff.
One of my thoughts, let me see, does it show up? Okay. Like, what if spirituality wasn't in this group here?
Hmm.
And we just had a disaster of some kind, and we just have therapy that's physical and intellectual and social and emotional. Ooh,
Sorry, I spotlighted you to.
there it is. There
Oh,
it
there
is.
we go. Okay, yeah.
Yeah. So what I'm hearing from you, Chris, there is like, it's just it feels a little too small of a world here.
Yeah.
And so if we really allow spirituality into these questions, into this world, all of the worlds open up. That's the word you use a lot, also, open.
Mhm.
And I think without it, then all the then all the worlds fall.
Without it, they fall off.
Yeah, there you go. So thank you.
Yeah.
Thank you.
No, thank you for that. Yeah. That kind of sums it up. Like, there's not as much expansiveness, and it's limiting. Yeah.
It's interesting you brought that up, Charlotte. I was just thinking, and Chris, what you were saying too. And it was one of the closing statements in my dissertation is preserving the humanity of therapists, the clients, and the treatments themselves. And what Charlotte kind of illustrated there is almost spirituality is the glue that holds all those spheres together. Without it, I feel like everything just gets siloed. Like we're working with either cognitive interventions, or we're working with emotionally focused interventions, or we're working with behavioral interventions. And so Dr. Archibald talked about totality, kind of unity. Makes me think how the spirituality of it kind of unifies all of that into not a perfect one, but it holds it together in a way where also, too, I think it allows for the individuality of each clinician to come forth. And as you said, one word that really excited me, Chris, was animation. I have seen clients come alive, even like with a behavioral change. So I think a behavioral change can be spiritual in a sense. I've seen therapists come alive when their clients have a breakthrough of sorts after slogging through a lot of sessions where, like, what am I doing? Am I helping this individual? So I really think there's a lot to be said with the reanimation and rehumanization of possibly what's gotten beaten out by the scientific study and the clinical study of the psyche and psychology.
Yeah. So many things. Yeah. Okay, I have a question for you, Dr. Archibald. It's so when you're seeing the whole of something or a client, and you're taking in the whole, the whole being, does that help in some way with activating kind of a love of a kind? Like, is it connected? Because I have this sense of, if I see the whole, that there's a connection. But
Yes, so in a sense, the way I explain to my clients this integrative medicine, or this holistic perspective, a philosophy of of approaching mental health is I tell them that the human experience lives within this ecosystem. And we have this ecosystem that includes other systems of the mind, the mind system, the body system, and the spirituality system.
Mm.
And that each one of those systems have a relationship with the other.
Mm.
Each one has its own strength and challenges and spring well of knowledge that we can pull from.
Mm.
And each one of them tend to have its own almost lived experience of what this thing that they are coming to therapy for, whether it's called OCD or generalized anxiety or depression, that each system in the way within that ecosystem of the self has its own experiences and impacted differently by depression, for example, of post-traumatic stress. There can be two clients who have the same label of diagnosis of PTSD, but they might not have their spiritual system or experience doesn't have the same understanding of what happened than the body. The body might have its own different understanding of what the event was about.
Mm.
That is not what the mind thinks about it, and it's not what the spirit thinks about it either. However, we kind of have to explore when well, what is going on in a sense, and post-traumatic stress for one person can elicit existential fears and existential even a crisis of who am I as a person. And to some people, it doesn't reach that level of distress within that own sphere of spirituality, who I am. So so we are exploring together how they defined what spirituality is for them.
Mm.
And sometimes they actually do not know, which is fine. I'm not really all that concerned about it. Where love comes in is what that word of openness that you're talking about. I am over and over in let's see. To me, I came to psychotherapy as a clinician because I've had an experience with as an intern with a 4-year-old who had her own experience, and I came in deep interconnection with her, and that that experience was so sacred to me that it actually shifted the path of my career completely. And to me, it was a spiritual experience. And from that event, what was really clear is her essence. That was really very clear to me. And I don't know how I can explain that with words, but there was nothing confusing about that. And every time with each client, more or less, that is really very much what is present for me. So I'm experiencing that first, and then I have to kind of map out the symptoms, which is, I wonder if other therapists who are listening to this is the way they're experiencing their clients' humanity, if they're feeling their presence. And then I had to learn how to diagnose, because I could feel the clients essence, and I just thought, oh, they are just fine. And then I had to tell myself, but they're here because they might not experience that themselves. So then we had to discover what was it that they were experiencing in their humanness. What was the anxiety, the thoughts, the body sensations, the fears, and all of these things. So it's a hard question to answer in that when I would meet a new client and when I still do, I experience that first, and then there's something almost magical, like you're sitting, you did a long hike and you're in front of this scenic view after this experience. You're like, wow, this is really cool. And so to me, this is almost like the beginning of therapy. They're like, wow, this is really, there's this concrete, tangible experience of awe that is there, and it is very much, to me, the basis of where that love is coming from. Agape is being that Roberto was talking about, like, the gift that psychotherapy has given, offered him in exploring some of these things, and to me, that's what psychotherapy has given me that I don't know. I could have known that about myself, is in any other work than just seeing how obviously sublime the human is, however complex the psyche is. And so I really don't know if that answers any of your question.
It does in a lot of ways that, yeah, experientially it does too. Yeah. I don't have to pin it down to one particular thing. I want to hear from some other folks too. And I actually, Roberto, I did have a question for you too. And I had a question for you too, Charlotte. So Roberto, when you work with clients that have some type of spiritual practice or belief system, how have you seen that help them in their journey? Like, what are some, I heard you talk about the community aspect, that sometimes a spiritual thing can come with a community, but I mean, what have you seen?
That helps them.
Yeah.
Well, a lot of what I get is resistance to exploring spirituality, and a lot of that looks like they say, I'm not religious, but I'm spiritual, right? Even though I ask them, what does your spirituality look like, they still go back to the resistance first and then trying to justify. And so the studies do show that people that engage in spirituality or have a spiritual preference have higher chances of successes when it comes to substance use, right? Substance use disorders. So I kind of give them that psychoeducation, and then I tell them, let's explore, what would you like to do, right? Would you like to go to the Buddhist temple? And they get this like smile, like I could do that. So then I get to explore with them what it would be like, and so let's create that for you, because in the 12 steps it says, God to your own understanding. So figure that out, right? A higher power to your own understanding. And so I kind of plant the seed for them to think it doesn't have to be this negativity. It doesn't have to be forced. It doesn't even have to be, right? So the way that I show that it benefits them is because they get to develop choice and practice their individuality, and then they come to me and they go, you know what, I like what you said about the universe. let's practice that, right? Let's go with that and see what we get. And I say, what's happening right now? What if you just voiced it out loud? Hey, universe, what am I supposed to be learning? Because this kind of sucks. And so they're able to, what I've noticed, the benefit is they develop their autonomy and recognize that they're making their own choices, and then are able to basically outline that for themselves and to be able to say this, if I could do that, I could probably do anything, which means stop using the maladaptive behaviors that you do. So I have seen that happen. That's a great question. Thank you, Chris.
Yeah. So I heard in there too, like you're asking them about spirituality, does it factor in, or how do you, and sometimes there's a fear that they're going to be pushed towards one thing or the other, but then you create this space where they can have autonomy and choose, and then that opens up something, kind of like you said, it opens up a sense of possibilities sometimes.
Yeah, I think it kind of almost like if I'm giving them permission to be creative on their own. And so I go with the, I'm like, yep. What else you got? What if, and then I throw in a little what ifs. What if you did this? What if the universe really heard you, right? Does it have to be a man? Could it be a woman? Is it an object or a thing? And they're like, oh, so it kind of opens them up. And that was the benefit that I see, is to be able to get them flowing creatively in their own juices, and to be able to be a little bit childish, and to be able to say, gosh, this is what I really thought God was like, in growing up, and what I really expected. And here I get to practice it as a grown man with somebody who's really not directing me like I thought he would, especially in the working with veterans and first responders, how they have this preconceived notion of God is the Holy Trinity type of aspect. So they get to experience that.
Yeah. And I was thinking about how you said earlier about how for you with penance comes pride. So then we mentioned that, like originally there was this wonder and this openness, and then it was like, wait a minute, I have to give penance, and then where is my pride or my ego in it, and all that. So then you're kind of also healing that with them, maybe for some folks, if they have that background too, or they're assuming it's going to be like shaming. If you're talking about spirituality, they might assume it's going to get shaming and blaming.
Right.
And you're
hellfire and brimstone, right? Where they're expecting like the world's going to end. I'm like, no, this is a new chapter, and it's a new beginning for you if you want it.
Yeah. And I know we're coming up on time. Charlotte, I had a question for you. This is a really good conversation. The time flew by, but it seemed like when you were giving your initial talk, what came up for me was the experiential aspect of, for me, a lot of it made sense in terms of how do I experience my spirituality in session, or because it was a lot of like, it almost felt like steps in terms of presence and cultivating the felt sense. And so is that part of what's going on with that? Like, is that part of what's happening, is like how to put it into practice, kind of in terms of? Okay.
Yeah, so there's what you as the therapist can be practicing, that like you said, you can have your spiritual practice that you don't tell the client about.
Yeah.
So you can have your experiential practice you don't tell the client about, but both of those are helping the session.
Yeah.
And then there's what we've been talking about what Robert just talked about guiding the client to their own spirituality. And then what I was bringing up is how this kind, friendly process can go with the client anywhere that they go now. If they find it in the therapy room with you, and they know the steps and they know the environment, how can they take that with them outside of the therapy room?
Yeah, I'm glad you bring that up, because I feel like the spirituality can help give me courage and help me go where the client needs to go, and help me be with the unknown versus needing to control or needing to fix. And I can have this process, like the clients seem to benefit from me being present, for example, regardless of what my belief system is about being present. Which I could be wrong, you know what I mean? It might not mean any of those things that I think it means, but they're still benefiting, and it's motivating me to take presence more seriously. So kind of I know we're at time already. I want to say I appreciate you all doing this. I hope we could consider doing it again. And maybe if we want, we could invite people to attend. We could be totally free form. We could do it however we want. We could take questions the whole time. But I appreciate
Just as long as we're serious, as long as we're
gotta be
very
serious.
serious about it, extremely serious, Chris.
We got to have our acronyms in order, everybody's degrees, name drop your degree as much as possible. No, I don't do that. Yeah, well, any parting comments or takeaways before we sign off?
Yeah, this was really fun and enlightening, and I think that's what the idea is, right? To experience some fun and joy and pleasantness, so
Yeah.
that we can go back to dealing with the reality of helping people with serious stuff, right, Chris?
Yeah, that's right. Yeah, right. Exactly.
Right.
Yeah,
Well,
thank you.
a little tongue in cheek, but I think that this is a spiritual profession, and I see a crisis in terms of therapists in burnout, in terms of just, and I think that we really need to call back to the spiritual base in order to kind of revive and resuscitate what I see as an epidemic of burnout that isn't going to be addressed by self-care or bubble baths or taking a vacation.
I was hoping you'd say bubble bath. Yeah. Nothing against bubble baths. They're pretty cool, but they're not going to solve the problem.
So, just
You're
just
not
calling
using the right oil.
Maybe it's just
absolutely. We'll close on bubble baths.
Yeah.
But thank you so much, Chris. This was so much fun. Charlotte, thank you for the visuals. Dr. Archibald, always a pleasure. And Roberto, such a pleasure meeting you.
You too.
Yeah.
Thank you. That
Thank
was
you
so
all.
wonderful.
Good. I'm glad. Thank you all, and I will see you all soon.
Yeah.
All right.
All right.
Take care.
Bye.
Bye-bye.